Did you know that if you're over the age of 65 or have a chronic disease and you will need to receive CPR while in the hospital, your chances of surviving long-term to discharge of the hospital is 18.3%. My name is Linda Beatty, and I'm a registered nurse with Guadalupe Regional Medical Center. I'm a certified in basic life support and also in advanced cardiac life support. While CPR can save lives, a patient's age and medical conditions may diminish their survival of CPR and the effectiveness of CPR. An advance directive for end-of-life care is a very important document to have. If you're over the age of 65 and you have a chronic disease, everybody should have one filled out. This document can speak for you in the event that you are unable to do so. An advance directive lets healthcare workers know what your wishes are. I'd like to take this time to investigate the possible end-of-life options for individuals and to give you more information on choices you have, whether it be CPR or life support as a means to sustain life, or by establishing advance directives to inform others of your end-of-life wishes. CPR or life support is used to sustain life in the event that your heart would stop or you stop breathing. CPR or cardiopulmonary resuscitation is a manual breathing and compressions on an individual's chest if they're found to have no pulse or breathing. This usually results in broken ribs, which usually causes a pneumothorax, punctured lung. Along with CPR, if available, an electric shock would be administered to the heart to jumpstart its electrical node or to shock it back into a viable rhythm. Drugs are also administered, epinephrine, and to stimulate the heart back. Life support is used after an individual is unable to breathe on his own. This is achieved by placing a tube down the throat and connecting it to a mechanical ventilator. The effectiveness of CPR and life support to prolong life is a growing problem many of us will face, especially as the baby boomers grow in numbers. The question is, will CPR or life support really help or prolong your life? And studies show that CPR doesn't usually work as effective as people think. If you have a serious illness, the odds are less. People who are diagnosed with fatal illnesses such as certain types of cancer, dementia, and those who have long-term medical problems. For example, if you have emphysema and heart failure, these are less likely to benefit from CPR than a person who might have mild asthma and another health condition. This is according to H. Dunn, his book on cardio resuscitation, hard choices for loving people. The survival rate in the older individual, according to the New England Journal of Medicine, is 18%. That is those older than 65 who receive CPR, that they will not survive long enough to be discharged from the hospital. That's according to a study that was conducted July of 2009. However, the study period from 1992 to 2005 showed the number of people in that age group who had jumped 37% from 3.8% in 1992 to 5.2% in 2005. Everyone should have advance directive or end-of-life wishes that need to be respected. If you decide not to have CPR or life support, there's a paper that needs to be filled out and on your hospital records. This is called a do not resuscitate order. A medical power of attorney also can be filled out. This gives a person the ability to make medical decisions in the event that you're unable to. A living will is also another form of advance directive. In the event that you're hospitalized, it makes sure that the hospital has a copy of this on the chart. The physician will write a do not resuscitate order. This does not mean will not provide care, but this just means in the event that you quit breathing, they will not perform CPR. The time to make these decisions is now, when you're able to make clear decisions and have time to research your options. While CPR can save lives, the patient's age and medical condition do diminish the effectiveness. Each choice is different per individual, depending on age, health, spiritual readiness, is a major factor for end-of-life decisions. Whether your wishes be written in form and advance directive, you will make the decisions for you easier, plus for your family members. And I do have copies of this do not resuscitate order that is in effect for Texas. If anybody'd like a copy, I have them on the back table. Thank you.